said, they get to about the width of a cigarette and they stop. I have had cases of patients who didn't show up when they were supposed to, but the laminaria only go to a certain point and they stop. So the risk of infection will increase the longer that cervix stays open, but that's a known risk of the procedure. But as far as the laminaria is concerned, the diameter of the laminaria will not increase beyond, say, about 8 hours, and that hourglassing effect is not going to suddenly occur just because of the longer times. So the great question, whether she comes in 4 hours later or 2 days later, the laminaria can still be removed.
And so that, in essence, would give, assuming that there's a procedure in place, that would, the time frame is such that safely getting these women to a place where follow-up can be provided and things like that is not an unreasonable thought. It does not have to be removed this minute, because 15 minutes later it's going to be worse, and 15 minutes later it's going to be worse.
That is true. That's a great question, and I'm glad you brought it up. No. As I said, once they're dilated, 8 hours is about the max time. After that, they're just sitting there.
But just to clarify 2 points on that, you said that the risk for infection actually becomes greater the longer that they're in. Is that correct?
Well, because the cervix is dilated and the vagina is not a clean environment, we have to believe that there's going to be an increased risk of infection the longer they go. So yes.
Okay.
Yes, there's a greater risk, but again, for instance, as I said, we've got quoted papers of people who have been dilated over 2 days with multiple tents, and so we're talking, especially when you're talking about a second trimester being the abortion, these people have had laminaria in place for as long as 2 days. And I've personally taken out laminaria in those situations, again, had no complications. So the message is always the same. Oh, by the way, there was one mention in one of these papers about you might give thought to, well, gosh, the cervix is like 3 centimeters dilated with this laminaria. Should I even be thinking about a cervical cerclage? And their feeling, at least the opinion expressed in the paper, was no. You don't. In fact, you only complicate the situation further if you're thinking of reinforcing the cervix with a cerclage. Remove them, put them on antibiotics, and let nature take its course.
So if it's been 2 days by the time the girl actually gets to the hospital, once she's here, is it a matter of she should be moving quickly, we should be moving quickly to get the laminaria removed?
I think it's always an advantage to get them out as soon as you can. The longer you wait, for instance, let's say there's an 8-hour delay. I mean, that's not unusual in emergency rooms. But the laminaria is not going to dilate anymore. It's about roughly an 8 to 12-hour limit when it's going to have dilated as much as it's going to dilate. But certainly, with the cervix open and bacteria in the vagina, the risk of infection will climb as time goes by. It's not a reason not to do the removal. In fact, it's all the reason in the world to do the removal.
And is the girl experiencing pain at this time?
They can have cramping. They may get light bleeding, unless but typically they're not particularly uncomfortable with them. If they're infected, I mean, if you've got a patient with really noticeable pain or uterine tenderness with laminaria in place, you've really got to be thinking this patient could have a chorioamnionitis. As I said, we always told patients they would have some mild cramping, they might have some mild spotting, but generally heavy bleeding is not a part of the picture. That'd be unusual. If she's bleeding significantly, then my best guess would be that a miscarriage is already underway. Or if she's significantly tender, then you've got to really be thinking about the possibility of chorioamnionitis having already gotten established or endometritis. So no, mild cramping, spotting is typical, and removal is not painful.
Doctor, the girl's discomfort will increase with each day that more laminaria is put in, will it not?
Not typically. That's part of the reason why you use these. Dilation is so gradual over time that I think she, physiologically speaking, accommodates. I mean, as I said, it's a very, very slow, gradual dilation. I would place 1 or 2 or 3 in an evening, bring the patient back. On a second trimester abortion, 2 days before, I'd start the evening 2 days before, insert 2 or 3, bring them back the following morning, insert as many as I could, bring her back later that day, insert as many as I could, and then the following day do the procedure. But I rarely got complaints from, in fact, I can't ever remember getting a complaint from a patient about, like, I'm getting increasingly uncomfortable. If the patient is complaining, I'll say again what I said just now, if the patient's complaining of pain, then something else may be going on, specifically an infection or something else is wrong. Now, it is possible for people, as I said, people will spontaneously miscarry with laminaria. That happens. That's why if they're having significant bleeding, you want to take a good hard look at that. Probably, best with an ultrasound. Is the water intact? Is the baby still alive? But if she's having significant bleeding, it's most likely she's going to miscarry in any case. Go ahead.
What's the expectation of checking? You said a number of times, easy to pull, relatively easy to pull the laminaria out, and go ahead and do that. But what's the expectation regarding fetal well-being checks? Is this something?
I'm sorry, the expectation regarding?
Fetal well-being checks, should we be monitoring, heart rate or any of those kinds of things for the babies?
I think it would be very appropriate to perform an ultrasound for starters, if you wanted, and demonstrate fetal viability before you even proceed, or certainly afterwards. I mean, it would be good to have that documentation that at this time we had a normal fetal heart rate and everything appeared normal, or that even more importantly that the amniotic sac was intact. I think that's never hurts to get that information. It's not totally necessary, but it would be a good thing to get.
Can the laminaria sticks themselves contribute to the rupture of the amniotic sac?
Say it again, Can
Can the laminaria sticks themselves contribute to the rupture of the amniotic sac?
Oh,
do they only
absolutely.
serve- Yeah.
Absolutely. As they grow and they swell, they can pierce the sac, and you will occasionally get patients who will tell you that they've had leakage of water at some point after a placement of laminaria. So yes, laminaria themselves can pierce the sac. The interesting is I don't think it's all that common. Again, my second trimester abortion experience with patients typically getting 3 insertions, ruptured membranes at the time of the procedure was actually quite rare. It can happen, but it's not a common occurrence.
What kind of support and counseling? This is a woman who's made one decision and then at the last minute chooses something else. I mean, there's a lot of literature on, being able to take the baby to term and deliver healthy babies, but what's the psyche of these women?
Clearly, the lady is conflicted. She is very likely she is feeling pressured. Most women who are undergoing abortions are under tremendous pressure. There's lots of reasons why people seek an abortion as an alternative. They're concerned about their family's opinion. They're worried about their future economic well-being. You know the list. It's very, very long that women feel pressured into an abortion. If she's changed her mind, that tells me that she's either rethought it or she may be feeling pressured in the other direction. So clearly, counseling and support are really important to this young lady because obviously as a male, gynecologist or not, I can't even imagine the psychological pressures of her going back and forth with this kind of decision. I think it's fairly common. I think it's more common than people realize, even in women who go through the procedures. A lot of women may feel strongly that an abortion was the right choice at the time they made it, but there are certainly many, many women out there who regret their abortion choice after it's occurred. I think this illustrates that point more than anything else, that many people, I'm sure, go through these conflicts. The problem